health matters, and overweight people are said to be more at risk of dying from COVID-19. This is according to a new study by the Public Health England. The study further says that every kilogram that you lose reduces your risk. Well, let's get some advice from fitness coach Tim Mumba. He'll give us some health tips. Tim, a very good morning and thanks for your time. I suppose just to clarify for those who are not sure whether they fall into this category, who would you say, or how would you know if you are overweight or obese?
Good morning and good morning to the viewers. We look at the BMI, the body mass index, to answer your question. If you have a body mass index of 25 and above, that would be classified as overweight. But 30 going forward, that would be obese. So there's a difference between obese and overweight. So if you fall under that BMI, you'd be under a risk.
How does somebody work that out, though?
Okay, there's been a calculation. Basically, a body mass index comes with your height, the right weight for your height. Basically, is calculated from that. So someone might look at themselves in the mirror and think that okay, I've got a good weight for my height, but the BMI will say something else.
All right, so let's get practical then for those who are worried about themselves at the moment. And, you know, it's not, I suppose, there are all kinds of precautions you need to take, especially if you're somebody who's never exercised before. So let's just start with the precautions first, Tim, for those who want to get going and want to reduce their risk. What are some of the basic things you can do?
Okay, we basically, as fitness professionals, we're not saying, okay, now you need to lose weight, you must go run a marathon or whatever. So start in the basics, start in the kitchen, basically look at what you're eating and start moving more. You know, lockdown being here has confined us in our spaces. We're not moving more, we're not moving a lot, we're not burning a lot of calories. So I would suggest that start with a 30, 50-minute walk, you know, outside in the morning before you start work, before you after you get up, you know, just start moving more and cut a few stuff in your food like sugar, cut carbs and fatty foods. Stay away from junk food, you know, something small. You start from there.
All right, and is it true? We're constantly hearing that all you need is 30 minutes a day. You don't need more than that. You don't need to be sweating buckets to say that you are healthy and you are fit or working out or be in pain, actually. So I think just so that people start easy, and it's not a one-size-fits-all solution for people who might find themselves in this position or at risk.
Yeah, exactly. Looking at exercise, like if you are a first timer, I wouldn't basically say climb the mountain. We start from scratch. You know, I would like now if I say start from 30 minutes a day, within a week, within 2 weeks, 30 minutes would be easier. So you push it up a little bit. And again, looking at COVID, you don't want to put a strain on your immune system. The vigorous training does put a strain on the immune system. So you need to. There's a borderline, basically. So you need to move, you need to exercise, but not vigorously. So that's why I suggest start from 30 minutes of activity a day.
And I suppose, like you say, just because you're moving doesn't mean you can eat whatever it is you want. So you've got to balance the two out, because diet still forms the biggest part of all of this. So don't just think because I've moved 30 minutes, I can have an entire chocolate bar now or a piece of cake.
Exactly. So basically, weight loss boils down to calorie deficit, basically meaning putting in less and putting out more. You know, eating less calories and putting more output, basically burning more calories.
And you know, the other thing is, Tim, when people do start to move and they do start to get active, we must be prepared that our appetite is most likely going to increase as well. And we're not asking people to starve themselves. On the other hand, it's just about making sure you're eating the right thing when you get hungry after exercise.
Exactly. That's why at first I said start cutting down if you stop. You know, even if you're hungry, you basically get more hungrier when you train, you know, because you're burning energy and your body requires energy. So when going back to eat, look at what you need to eat, choose what you eat, you know, change your diet. Like I said, stay away from sugar, stay away from cut some carbs, cut some sugar, cut some fatty foods in your diet. So those are small changes that you need to make.
All right, Tim Mumba, thank you very much. Yes, that is it. Start slowly, but make sure you're moving. At least 15 minutes. Start slow every day if possible.